Namaste, everyone. I'm back to the discussion on health data and data platforms. So earlier we talked about the progress and the challenges, and now I'm switching to the area of data platforms, how we can leverage them, what are some of the good data platforms that we all can leverage, and where I've kind of mostly sourced the content from. So, I think everyone now knows of what the LLMs are, and ChatGPT, Google, Gemini, etc. And now, of course, DeepSeek AI is also in the scene right now. And with that, I think we know how to. I mean, many of us know how to leverage these platforms, right? So, when I was trying to create slide, I was trying to, kind of collect and collate the factors that would impact individual health, right? So I was trying to list one by one what are the factors that would be impacting our individual's health, and I was trying to organize them. This I started putting them and try to organize. Okay, it took a while to even to put list them these things down. Okay, then I thought, let me try this and ask ChatGPT. Okay, and within a minute, I got very well structured content. So that is the power of these LLMs like ChatGPT and Gemini. These are like uh, they have read all the publicly available literature in every possible subject, and you can ask that question. It's like somebody reading every possible book on the planet, and they have understood somebody that person has understood, and is able to, he or she is able to answer any questions you ask about those content, right? And with respect to human beings, we know that even if you read just few books, we struggle to kind of recollect and recollect the content, and also tell those that content in a very structured way, right? We struggle to do it, but the computers have reached AI systems have reached a stage where they can handle really really massive data and give very precise, very well structured answers, right? So the chat GPT, through these answers, you can see that there are various aspects that kind of impact individuals' health: biological, behavioral, social, and environmental, and healthcare related factors. In the biologicals, there are genetics, age, sex, gender, immune system, etc. Right? These are all the factors that would impact one's health. And in the behavioral and lifestyle factors, we are definitely the diet and nutrition. Earlier decades, we were kind of short of food. People were kind of undernourished. Now there is a overnourishment and also wrong nourishment. That is the reason there's a lot of obesity, and also a lot of diabetes and blood sugar. Sorry, the hypertensions are, so they have spread significantly in the population, right? And the physical activity is another factor. So we know that in earlier people used to be very physically active for jobs, and even in going from place A to place B. Now we have all kind of become sedentary. We sit in office and talk, and we sit in vehicles and travel, and we hardly kind of walk. So this is, and essentially the our physical activities have come down. In fact, there is a saying that sitting has become the new smoking. So that is the kind of impact of the sedentary lifestyles what we are all used to, especially the blue collar jobs, not sorry, white collar jobs, okay, or the office jobs. That where have reduced our physical activities, and then other aspects of behavioral are smoking and substance abuse, alcohol, etc. And then the sleep habits, we need a good sufficient sleep, where it's during the sleep most of our body maintenance activity happens, and also processing of the information whatever we kind of gather during the day. So unless we have the good sleep, we will not be, both our physical and mental abilities will significantly reduce. And stress and mental health, those are also factors that would impact our health. Stress for various work related, relationship related, finance related, right? So there's so many things that we all go through in a modern lifestyle, modern life. And so that will impact our health as well. Social and economic factors, so income and socioeconomic status that will create some challenges if you are in a disadvantageous position. If you're lucky, it's okay. If you're not, I mean, for the vast majority, that's not so great. And education also creates an issue. I mean, if you lack education, your opportunities would be limited, and so it can lead to poor quality health as well. And you need social support, in terms of family support and neighborhood support and all those things, right? So if you have good relationship, they can really help us in coping with a lot of the things. And it can also create virtuous cycles, and the reverse is also true. It can create vicious cycles as well. And the environmental factors, the air quality, it's a major issue everywhere in urban, especially big cities in India. And we have some of the worst polluted cities in the world. As the water quality is a major issue. And, so the rivers are polluted, and the river, from agriculture runoff, industrial waste, and, the urban waste, they all get dumped into rivers and lakes, right? So, we directly and indirectly consume this polluted water. Living conditions, so the housing quality, if they don't have sufficient light and fresh air, that can create a good sanitation, sanitation infrastructure. And the place is too crowded, too noisy, they all can add to negatively impact the health. Right? So the climate change is another thing, and so if there's no rain or heavy rain, or wild variations of temperatures, all these things can create health problems. Right? Work environments. So there can be pressure. There can be physical risks involved in some of the works. And some of the, for example, if you're a truck driver or a bus driver who sits in the same place for long hours, and so that, and also kind of very, if you're driving in a stressful, very traffic heavy conditions, then it can also induce a lot of stress. In fact, urban transportation, especially cities like Bangalore, the traffic is very heavy, and driving heavy buses like DMTC and all, so it's very stressful, and it can lead to a lot of health issues. Right? What other factors impact the healthcare? The healthcare access and quality. So if we don't have access to doctors, or the medical facilities, or the pharmaceuticals, or the equipments, etc., that can impact as well, especially emergency care. Right. So during some emergencies like accidents, or some heart attacks, etc. So there is a golden hour period, right? The patient has to be treated, and given some first aid, and then taken to the hospital, or the or within a very short span. Health insurance can also impact, right? So if you have eye insurance, the people will be able to afford certain procedures or certain care, and if not, people will kind of shy away from taking those cares. Health literacy is important, and what to eat, what not to eat, how to eat, when to sense things and when to go for checks, preventive and curative, etc. Right? Preventive care is very important these days. The regular screening. So, especially for people middle age and later, that becomes very important to kind of diagnose things early, so that the treatment becomes easier, cheaper, and more effective. And there are cultural behavioral norms as well that will impact the health. Right? So there's so many things that will impact the health, and these are the things that I got from ChatGPT. Really very nice answers. I was trying to get to these points myself, manually. I mean, collecting one by one or organizing them, but ChatGPT gave it in no time. And there are a few other factors. I'm not going to run, talk through them, so you can see these things. So, for any of these things, to understand the factors that influence the individual's health as well as the public health at large, so we need really good data, and also ways to analyze this data, with the good analytics and visualizations, right? So that they're very critical. to understand and also to come up with the action plans. So with that, I just showed you how we can leverage, LLMs like ChatGPT, to understand various aspects of not only health, other related aspects of education, economy, environment, etc. And there are, in addition to that, LLM, ChatGPT kind of, and ChatGPT or Gemini, Google Gemini kind of platforms. There are other real good data platforms. So some of them they give data and good visualizations. You have to, use I mean, they show gives basic visualizations. But some of the platforms like Our World in Data, they give amazing analysis and visualizations that you can kind of spend your rest of your life to understand this data in various aspects. I'll go to some of these platforms. So I'll just go. This is a kind of big picture about some of these data platforms. Our World in Data is from Oxford University. World Bank data is amazing. UN there's a portal for UN data as well. And World Health Organization (WHO) also has a data platform. Worldometer, people use this one extensively during the COVID. And IMF, like World Bank, also has great quality data and good visualization capabilities as well. These are all public data platforms. In Wikipedia is another platform. So of course, this is publicly edited and what is it, crowdsourced Wikipedia. I mean the encyclopedia. Obviously, there's some bits people will question, but I think largely because it is public, the sources are publicly put in place and the references are given, a lot of references are given. It's I think it's really really comprehensive. And there are other private data platforms like Statista. They give good data, but you have to pay some money for them, and the subscription prices are not too heavy, especially for organizations. There is also macro trends and India stats. Those are also paid platforms. Okay. So let's look at some of these data platforms. As I said, data.worldbank.org. I will open this one just to show this platform. You can see this is really amazing, the very simple data platform. For example, you want to see the GDP of India, GDP growth, uh, economy GDP growth annual percentage. You see this, and it shows the growth rate, this one, and then you want to pick for example, India. It initially it showed for the world. Okay, so this is the global or GDP growth over period. You can see that during COVID, it shrank in 2009 during the global financial crisis, and then during COVID 2020 it shrank by to almost 3%. Okay, this is the global average. In 2021, it recovered by 6.5% because of it went so much down during 2.9% in 2020, and recover, say, kind of reverse happened in the next year. Then you want to see this same GDP for example, India. Okay, and you select this country. Okay, so you can see this, the global growth. I mean, say India's GDP rate. You can see that there are a lot of lies that have been circulated. If you see that the highest growth happened between 75, this happened 9.1% in 1975, and then the next highest growth happened in 1988. Okay, so you see this 80s was one of the the best performing period, and then we had some periods, so 99 it increased by 8.8%, etc. And then the entire 2003 to 2009 we grew very well. And then there were some challenges during the financial crisis, right? And a global financial crisis. Even then, we were positive, we were not negative. Okay? So this the growth has been really fairly good. and these are all adjusted for inflation, so as well. So uh, don't go by some of these selective storytellers, and I have a separate video on this global growth. I just wanted to show this, so suppose you don't want to, this is GDP growth is research, then for example I want to search life expectancy. Life expectancy at birth. Okay, but birth total. Okay, so it shows global average, and you can see that in 1960 it was 51 years, and it kind of continuously increased from 1960 onwards. During COVID, it dipped. This is the global average. And the global average is 73 years in 2019. And now it is 72. Okay, in fact, in the last 4 years, we are last actually. I mean, it has come down. If you add India to it, you see this, so we had our life expectancy at birth was 45 years in 1960, and it continuously increased. In fact, when we got independence, our life expectancy was 33 years, and it increased to 45 years in 1960. And it has continuously increased. It's not only India phenomenon, it's a global phenomenon. India has done also fairly good job. Okay? And if you add, for example, China and say, for example, Sri Lanka, so we'll see the comparatively, you'll see the data. Okay. So you can see this China. Sometimes there's a few times the data issues are there. You can see that in 1960, the life expectancy in China was 33. Actually, in 1945, it was 40 years, and in 1960 it's 33 years. Either it's a data issue or there were some challenges in 1960s because there was cultural revolution was going on. We don't know. It could be a little bit of aberration, but largely the data is credible. Okay. In 1962, you can see this. You can take this data from here onwards more credible. Okay. And you can see that so they were at least 10 years ahead from 1940 onwards at least, because China, though it was kind of under the what they call great humiliation of 100 years, but they were not as much colonized as India was. Okay, and actually, China's life expectancy is higher than US now. And if you add United States to it, you see this United States, by 1960 they were already at 70 years, and they've been kind of slowly increased over period. And now that it's below China, so it was 79 years in 2019. Now it is actually 77 years in 2020. China has surpassed. You have to keep it in mind that China and India have 4 times the population of US. Okay, so despite having 4 times the population of US and less than one fourth of their income, China is able to have a much longer, life expectancy. That's an amazing achievement for them. Okay, so this is one of the examples of the, our, data, World Bank data platform. You can just say, you can just type the data.worldbank.org, so you will get this data platform. You can do a lot of query and analysis. And similarly, this is the another thing I've been telling you that so the our world in data is an amazing data platform. It takes data from various global data sources like World Bank, UN, IMF, etc., and they do amazing analysis. For the sheer number of areas they kind of analyze is unbelievable. You can see all these areas, are the topics: population, demographic, health, energy, environment, food and agriculture. Each one of them have amazing details. For example, food and agriculture. We were talking about health, right? You see the global health, cause of death, child and infant mortality, mental health, life expectancy, so many things. They give so much of data. For example, I'll take you take the HIV and AIDS thing, right? I talked about this earlier. You can see the kind of analysis that has been done, and the you can see the kind of the infection rates and the death rates, etc., causes of death. You can see that this is one thing that I picked in my slides. Share of all deaths caused by HIV and AIDS. So you can see that in Africa, more than 50% of the deaths in 1990s was actually happening because of AIDS. It's unbelievable. But good thing is that it has come down. Yes, you can add the countries as you wish. Some countries have been added here. For example, if you want to add to India to it, you can do it. Okay, so compared to African countries, India's infections and deaths are much lower despite high population. Okay, so this is an amazing platform. They're very good visualizations. You can switch between table, map, and charts, etc. You can This is the chart, and this is the map distribution. You can clearly see where the HIV/AIDS infections are, and then if you want to see the tabular data, you can do that as well. It makes less sense. Their map or the charts, charts gives the data trends over time, right? And you can pick whatever the countries you want. This is an amazing platform, and everything can be used for free. And I think it's a courtesy we need to quote the source, right? This is another platform that we can really leverage. And then WRI is another platform that we can use. And Coming to India side, there are many data sites. Data for India is in the recently added, created website. It's another great platform. So please go and leverage the data. And there are other things, India Data Insights, and then ISP School of Data. They have a data portal. Um, I think it's India Data Portal. I forgot to put the URL here. And and then NDAP is from Niti Aayog, National Data Analytics Platform. They have all the census and sample survey data and departmental data, cleaned and standardized data sets available here. You can do some minimal analytics on that platform. Okay. And coming to Karnataka, the Avalokana is a data platform. I mean, it provides some financial related and some development related data here. So I worked here. And then Karnataka Data.gov is a open data initiative actually similar to data.gov.in. This is a state level data platform. And Mahiti Kannada is another data platform by Karnataka government. And the data.gov.in is the data repository, the open data initiative of the government of India. So the data quality is not great in some of these platforms, but if you are interested, you can go and check it. India Data Insights.com. This is another platform. You can go and check it, take a look at it. Data for India. I told you again. This is just like our world in data. They take the data, analyze it, and visualize the data. And voice versa as well, visualize and analyze the data as well. So please take a look at it. So these are all great platforms. Okay, there are a few other things. PRS India. This is a great website, especially if you want to look at and compare the budgets of the central government over period as well as the budgets of the different states. This is a great place. They kind of analyze and show the summary of the budgets very easily. Okay, this HMS, Health Management Information System of Government of India's Ministry of Home and Family Welfare. This gives some data, but there is a latency. Typically, it's about 2-3 years old data. You'll have to take the data and visualize and make use of it. But there's a latency. In fact, the states struggle to get data from the center. So when I was working, so there was so much of restrictions on getting data from center. Though the data was going from the state governments, the state themselves were not getting the aggregated data. Okay, so here are some of the visualizations we did I mean, I was involved in this. In fact, I was the one who initiated this thing. So what we did, anyway, we took NFHS 5 data and also the two different sources, actually, one NFHS as well as the Karnataka at a glance. So the Karnataka at a glance, so they collect about 1,000 data points on an annual basis for various departments. So using two different sources, one is the NFHS, National Health and Family and Health Survey, which happens every once in 5 years by central government. Central government, I think, forgot the agency which does it. I think National Sample Survey Organization, NSSO, if I'm correct. So they do the sample survey, whereas the Karnataka Tech Glance is the kind of annual data collection process that happens by the Karnataka government planning department. So these are some of the data platforms, and you can, people are interested, they can leverage them. And then in the next video, I'm going to talk about some of the data challenges that are there. So yeah, they're platforms, there are data, but they're not free from issues. But something is better than nothing. The confidence in the data is could be 50 to 70%, so it could be in that range. But that's still much better than having no data, right? So I will talk about these challenges in the next video. Okay, thank you.